Here we go. I'll put it on there. Let's look at this. This is the second one. So the chapter 16 is the neurological exam.
Mm-hmm.
And that includes the mental status exam, cranial nerve exam, a sensory exam, a motor exam, and a coordination exam, which is sometimes called the Gait exam. So these are often they're done by a nurse or a psychologist. Sometimes a doctor will do this. It's a way to kind of check some central nervous and peripheral nervous system functions. And it's surprisingly specific, and you already know a lot of this stuff. So the mental status exam is primarily checking functions that are located within the cerebrum. The cranial nerve exam checks things that are carried by cranial nerves, but often we can localize them to specific places in the central nervous system, like a nucleus or something like that. Sensory and motor exams are checking on spinal nerves and things carried by spinal nerves that usually are carried to the cerebrum. And then the coordination or gait exam is a lot of motor function that's coordinated in the cerebellum. So then the mental status exam, the previous program went over that. That's orientation and memory. And by orientation, they're kind of focusing on memory. So with orientation, they're asking you, what day is it? What is today's date? Who's the president? What city do you live in? Things like that. And these help them check frontal lobe function and memory. Then a big thing is checking on language and speech areas. So they'll ask you to repeat stuff. They'll ask questions to see if you understand them. They'll ask you to respond to certain questions. Then they'll check some sensory stuff, the sensorium. And then they're going to ask you questions about that are getting at judgment and abstract reasoning, which are prefrontal areas. Ability to plan, to make decisions, to talk about your emotional regulation and your ability to control impulse. These things are all impaired in certain prefrontal lobe problems. And so we'll do that. I didn't say much in the previous thing about the sensorium. The sensorium, they'll ask you to describe something, or they'll give you a verbal description and ask you to do it. So it's checking your ability to kind of follow directions, and so that's linked to Wernicke's area. Then they'll ask you to identify things or be able to state words that they'll give you an object or have you touch an object, or they'll write a letter in your palm. And these are checking connections, often with some of the Wernicke's area and some of those types of stuff that way. I had some experience with mental status exams with my dad. My dad, that's him when he's younger. So that was him in about 1945. He was a World War II era veteran, and then he went to school for chemistry. But in his older years, he developed dementia, and that was a very particular type, a Wernicke-Korsakoff syndrome, which is it's a thiamine deficiency, usually caused by poor diet and alcoholism. So you get these memory changes where you have really trouble forming new memories. That's anterograde amnesia. So he could recall most things that happened when he was younger, but he couldn't form new memories. He had a little bit of past memory loss. That's retrograde. But then he was confused about a lot of details. That's confabulation. He would substitute details, and he had some lost functions. Okay, and a lot of this was diagnosed through mental status exam type questions. So, and it brings on dementia. Dementia is caused by a variety of things, just aging, but also exposure to chemicals, drugs, things like that, and infections can cause dementia. So, and developmental problems. And so in, whoops, is there somebody new here? I don't know. Okay, so often there's loss of neurons. And so you see this lower one is a typical changes you see in dementia. So you'll see enlarged ventricles, you'll see big spaces in here and smaller areas of the cortex. In particular, this area of the hippocampus shrinks, and so you get memory changes. Okay, so that's a kind of a mental status exam, kind of quick overview and reviewing kind of dementia and some things like that. I think I talked about long-term memory, and I'm going to talk about it, that's in this area here. Whoops, someone's coming in. So that's the hippocampus. It's part of the temporal lobe, kind of buried in there. Okay, so can I go down? Let's go. Okay, so then the next part of the neurological exam is the cranial nerve exam. And so the cranial nerve exam examines these cranial nerves, the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, vestibular, cochlear, facial, whoops, right, should have been facial, vestibular, cochlear, hypoglossal, glossal pharyngeal, vagus, accessory, and spinal. And so you get 12 of these nerves. And so some of these are sensory, so you're testing visual function with something like an eye chart. You'll use tuning forks, check the ear. You do some tests of equilibrium, see if they can detect odors, tastes. Those are pretty easy to do, but then there's some that are just motor. Lots of these have to do with eye movement, and so gaze control is important. You have, you'll take like a pen and you'll put the pen in front of their eyes and you move it this way and that way, to the left and to the right, and see if they can follow it, if their eyes can track. And so this tests 3 of the cranial nerves, oculomotor, trochlear, and abducens, and you can tell specifically which nerve is damaged with if they have trouble moving one eye or trouble moving eyes together. You can test some midbrain reflexes. This is a chart showing their information coming from the inner ear is used to help eye movement. So you make a sound and you have them move their eyes towards the sound. You can assess, like the facial nerve is responsible for facial expressions. So you look for symmetry in facial expressions, ask them to raise their eyebrows, look to the left, look to the right, open their mouth, move their tongue. The glossopharyngeal and hypoglossal, you can just have them open their mouth, say ah, move their tongue, things like that. And then the movement of the neck, these 2 muscles here, sternocleidomastoid and trapezius, are controlled by cranial nerves. Okay, and so it gives you very specific information, and those nerves are linked to very specific parts of the brain. You can check it. It's very quick. Doesn't take much. Okay. Then you can check some sensory modalities. These are spinal nerve functions. These different regions here, these are the dermatomes, and they're labeled by what spinal nerve is taking care of sensory information from the skin in that area back to the brain. And so like this region on the thigh is the lumbar, I think it is, second lumbar. There's lumbar first and second, lumbar second and third. And so you test their ability to detect touch and vibration in the skin. Sometimes you can do pain receptors by testing a sharper touch. You can also attest their ability for proprioception. That's the body position, and that's carried back to the brain by specific cranial nerves. Here they're showing motor nerves. These are in the ventral part of the spinal cord and the lateral, and then also sensory information is carried back in the dorsal region and somewhat at the lateral region. So you can get a good idea of damage to specific areas and specific nerves. Okay, with the motor exam, you're assessing muscle strength and voluntary movement. So you assess the tone, contraction against resistance, detect reflexes. Can also have them close their eyes and put their arms out, and if they have damage to some of these motor neurons, their hands will drift because without looking at them, they really lack information on proprioceptor, and the muscle contracts even when they think it's not. And so again, you can assess what part of the spinal cord is damaged or spinal nerve is damaged, and you can get fairly specific information. And so, so an easy way to do that relatively fast. Then the coordination and the gait exam. This carries, allows you to assess information on the kind of the motor pathways of command, and the cerebellum, which does a lot of the integration of sensory information that's coming in on body position and then with motor commands. And so you check for tremors, you check for a check reflex, you do the station thing where you just have them stand with their eyes open, and then you assess their posture and their gait. This is, again, if you're looking for demyelination diseases, if you're looking for Parkinson's disease, some toxicity type stuff, you do this. When they do a field sobriety exam to check if someone's been taking drugs and driving, they're checking cerebellum function. And they're checking your ability to use information and know where your limb positions are. And it turns out the cerebellum is pretty sensitive to alcohol. And so they'll have you stand with your arms out and touch your nose. And while that, close your eyes and do that, that's pretty easy. But if you've had 2 or 3 drinks, you'll miss. And so they'll get that. And so that, this is important type stuff. So used a lot, and very simple, fast ways to do stuff. Okay, so the neurological exam, the mental status exam, looks at behavior, thoughts, perceptions, language, memory, and judgment. The cranial nerve exam assesses special senses, gaze control, tongue, pharynx, pharynx movement, facial expressions, touch sensation on the face, and movement on the head. Sensory exam assesses the ability to detect skin sensations, including light, touch, vibration, temperature, pain, 2-point discrimination, and proprioception. Motor exam assesses muscle tone, strength, posture, and movements. And the coordination and gait exams assesses the function and connections of the cerebellum. And again, posture and movements are a big deal here. This baby here, this is looking at gaze control. So they've mapped out what muscle movements determine the movement of the eye. And so if you're following a pen, babies, they don't even have to speak. You just move the pen in front of them and see if they can follow it. And so they can map, if there's difficulty with one muscle, they can map which muscle that is. That might be the lateral rectus. LR stands for lateral rectus here, I think. And they can tell you what cranial nerve moves that muscle in a particular area and what region of the brain it goes to. And so, so again, with the neurological exam, I'm not going to ask you on the final exam how to perform one, but kind of an overall assessment or an overall idea of what's done by the neurological exam. So, so I know the questions for the quiz get pretty specific, but it's more about, if the cranial nerve exam, what's being checked there. The mental status exam, what are they doing? And this is meant to be done quickly, without a lot of equipment. And so what you usually need is something like a pen, a flashlight, and your own hands and the eye and observation, be able to hear what they say and kind of watch them. And so it's something you can do fairly quickly in the field, and identify whether someone's had a neurological injury. So it's a quick assessment that can be done without any specialized equipment. Okay, whoops. All right. Does anybody have any questions? Did that help?
That was pretty good, yeah.
Okay, all right. It's tough reading, and it's when you go through chapter 16, it seems kind of, it's just kind of how to do this and how to do that. but you kind of have to relate it back to what we've been talking about with the central nervous system and how the function is in different regions. And so it brings up particularly the function of the language areas, the memory areas, kind of knowing the prefrontal lobe, and then that motor system that we talked about, starting with the the frontal areas that determine movement and plan movement and control muscles, and then going down possibly through a direct pathway or indirect pathways that are going to the cerebellum and other areas. Okay. Let's see, what else do I want to say today? Next week, I will have review materials. I'll probably set up a Tuesday and a Friday Zoom meeting. And so the review materials, hopefully I'll have those Tuesday. I'll have essay questions. I will have a list of topics or objectives, and hopefully a review PowerPoint. Final exam, that'll be on Moodle. It'll be like this last exam, but longer. Be open May 11th through the 13th. I'll try and do 3 to 5 questions per chapter with a little extra on the last 2 chapters. So you'll probably get 50 to 75 questions, multiple choice, some true false, and then just 1 essay to write on. Okay, anybody else have any other question? Diego?
I'm all right.
Oh, you're okay. So I'm hoping you're looking at the brain and cranial nerve lab stuff and just practicing with that. I have a little video of a sheep brain dissection I'm trying to post, but I'm having difficulty because it's longer. But I don't know that it's an essential thing for you to look at. but I feel like I got to do it. And then next week I'm going to ask you to work on the 2 exercises on the sensory things, the hearing, the ear, hearing, and balance, and the eye and vision. So those are 14 and 15. But again, we're not going to have another lab exam, but there will be a quiz. Okay, there is a quiz on chapter 16, and there's a lab quiz on the muscles that's available right now. There'll be 2 quizzes showing up next week, and then I'll have something about other quizzes. If you've missed a quiz, there'll be a chance to make up chapter quizzes. Okay. Any questions? Okay. All right. I think that's all I've got. But again, probably Tuesday and Friday of next week, I will have Zoom sessions for review, and look for review materials for the final. Okay.
All righty.
All right. Well, thank you. I hope things are going okay. I should be downloading a lot of grading material in the next 2 days on Moodle, so you can check your grades. And we'll just see how it goes. Okay. All right. Thank you for coming. Watch for the announcements and Moodle grades and materials. I'm going to end the meeting.
All righty.
Okay.
Have a good weekend.
You too.
I'll try.
All right.